Guys, thank you so very much for coming on board.
Thank you for
And
Thank
having
you.
me.
let's get right to this whole topic here. I think that it's important, Dr. Lindsay, that we examine and review definitions of things like health disparities, health inequalities, and health inequity. Can you elaborate, please?
Health diversity refers to the differences in the burden of disease, injury, or violence in populations within a community. If we look across Virginia, for example, there are striking differences in health or disparities in health from one community or even within communities. For example, we mapped the life expectancy at birth of Norfolk residents across the city, and we found that there was as much as a 20-year difference in life expectancy simply based on where people live. If we looked at the leading cause of death in our community, and that would be cardiovascular disease, and focused on one of the leading causes for cardiovascular disease, say hypertension, and if I could achieve equity by deciding to treat everyone for hypertension equally by giving them all medication, then that would be equality. However, different individuals within that group may face different challenges in obtaining good control of their blood pressure and reducing their risk for disease later in life. Therefore, some may have problems with access to healthy foods. Some may have difficulty with transportation and getting the medications that they need. Some may be smokers. Some may have other health issues or problems that affect their ability to achieve good control of their blood pressure. So health equity would be about ensuring that each and every individual had an opportunity to achieve optimal health, taking into context all of those issues that may prevent them from being able to obtain adequate health in their lives, and therefore prolonging their opportunity to lead long and productive lives.
Much of what you said reminds me of a very compelling PBS documentary called Place Matters. You know,
Yes.
where you live does in fact impact your health outcome.
Yes, it does.
McBib, in your role as the Vice President of Diversity and Inclusion at EVMS, at a prestigious school like EVMS, how has that shaped your definition, your perception of health disparities and so forth?
Well, as Dr. Lindsay mentions, health disparities are, closely tied with social determinants of health, and social determinants of health on the other side define the inclusion, the capacity of people to be included actually in having access to good education, to good nutrition, to good health, and to living in safe environments. So those are the things that affect them. Now, the core mission of EVMS is to improve the health of the community by enhancing that inclusion, actually, in education, in providing health, medical and health professions education, patient care, as well as research. And so in many ways, in all our mission areas, which includes education, patient care, and research, we do try to expand that inclusion in access, right? And through that to improve the health of the community we serve. And so that's the mission.
So using an app, a platform to advocate for health equity is something that you incorporate into the training.
Absolutely, and really specifically by addressing those three mission areas.
Now, Dr. Lindsay, we're going to talk in just a moment about a little bit further about the social determinants of health. But again, this would actually be a question for the both of you. When we talk about crime and the impact of crime on public health, as we were talking to the police officers earlier, there are so many different things that when the impact, the effect of crime on the community's health. Can both of you please respond to that, the impact of crime on community health?
It was a very interesting discussion. And I think, when we think about crime, the perception of crime as well as the reality of crime affects one's health. And having a feeling of being in a safe, secure environment is critical to a sense of having a sense of health and well-being in a community. And as an extension of that, feeling safe in a community and feeling that one lives in a safe neighborhood and having access to safe parks, for example, may be very important in one's ability to be able to achieve opportunities for physical activity. And physical activity, again, connects to being able to be healthy physically and emotionally.
When one feels like they're in a safe neighborhood. One of the things that the officers talked about, the police chiefs talked about, was that they are seeing fluctuation in crime rates. How does something like that affect their community, McBev, in terms of public health?
Well, when you have a fluctuation in crime, and as areas are safer in many ways, children grow better. Education is better. The public school system functions better. So all of the things that you look at in terms of the social determinants are actually improved. And that is the thing that actually we try to focus as we are in the education environment, in our medical education environment, to look at our curriculum and see how do we integrate that into the core curriculum, so our students understand the root causes of those health disparities. So and then how do they communicate with patients in that way, so that we have actually you provide a quality care that takes into account all these other elements of social determinants that people come with. And so when you have environments that are deteriorating, you have to be able to understand that in a care environment, to be able to care for communities of that sort.
Dr. Lindsay, let's talk in greater detail about the social determinants of health. What are they, and if you could provide some kind of listing of what those kinds of things are.
Well, social determinants are those factors in the community, or those factors that impact whether or not we are able to live a healthy life. And they are conditions that involve how we live, work, play, go to school, and play and pray in our community. All of those things are factors that impact our health. If we look at them in terms of how we've classified them scientifically, we can start with the conditions in which we are born. Heredity is a factor that impacts our health, as well as gender and our environment in which we were born. Socioeconomic and environmental factors impact our health. The higher someone lives on the socioeconomic scale, the more likely they are to experience good health. Social connectedness is another factor that impacts our health, as well as living and working conditions, and behaviors, whether those are behaviors that are choices that we make or choices that are made for us by our environment. So such things as whether or not we choose to eat healthy, whether or not we smoke, practice safe sex, or unsafe, or practice unsafe practices, whether or not we use illicit drugs or drink in excess, are physically active and eat healthy foods. All of those things impact our health. So in essence, when we think about health, health begins long before we find ourselves needing to seek medical care for what ails us. Health begins in the home, with a safe and nurturing family, in a safe neighborhood, with not a lot of violence in our community. Health also begins with having good jobs, clean water, access to safe foods and green spaces. It's all of the things that we think about in our environment that affects the quality of life in a neighborhood.
You know, we did these surveys and I made a reference earlier that one of the people that responded to the survey described public health as everything.
It is everything.
Yeah, and it is indeed. It's the everything that encompasses someone's environment, and that can include interactions with police officers. Macbeth, what do you think is the impact of racial profiling? The police chiefs spoke very frankly about the reality of racial profiling. What do you think of the impact of racial profiling? What does it have on public health?
Well, there's this, the whole reason how we came to organize the session
The forum,
that we had, the forum that we had, was an article that was actually written in the Journal of the American Medical Association.
This is the one
by
that
a fourth-year medical student at Brown University.
Yes.
And this fourth-year student, what she said was, in the 4 years she has been a student, a medical student, she has seen many things out there, including the issues with Trayvon Martin and Ferguson and all of the issues that are happening that are related to the police and to public safety and to crime, those things that are happening. So her question was, how does that relate to her education as a medical student? How does that relate to her patients? And is it necessary or important that some of those aspects be integrated into her education as a medical student? Does that make sense, or is it important? And what she found out and how she explained about the curriculum that she had was that instead of that, it actually perpetuated bias. It perpetuated the other angle that we see in terms of profiling and bias, and that those are the social things that you see that perpetuate the disparities that we see in health. And obviously racial profiling or the perceptions of racial profiling have a major impact on society. First of all, it has a big impact on young people that are growing up, that are going to school, that are either going to medical school or not.
Right.
And that has an impact on the diversity of the healthcare providers that we see or not, right? So all those things have an impact on the outcomes of care that we see at the end of the picture. So what she said, what this student actually very courageously wrote in that article made a very big impact actually across medical schools in the country to come up with programs like we had, at EVMS, and to be able to actually explore how do we address these issues, these root causes of society, and think about them in terms of how we train our students, how we provide care, and how we think about improving quality of care to all communities. And so those are, profiling has that impact.
I think it's very important to note, and he's talking, Dr. Lindsay, about the article that I mentioned to you.
Yes.
It's important to note that this fourth-year medical student was not a minority.
No.
She was a white woman who, because of her position in her training, she had the opportunity to be objective and provided a great deal of insight.
Absolutely.
Yeah.
I mean, that was a very courageous and insightful, a thoughtful reflection that she had on her education, and on the impact of that education in healthcare. And there are many students, and we have many students who are actually, as the students that you saw, who were part of that forum, who organized the forum actually, who were also not all minority, but white and Asian and African American, who come together to think about healthcare as something that we all need and deserve, and we have to think about it in those terms.
And it really becomes an issue of the health of the public.
Yes.
I'm afraid that we're about to run out of time. And so I want to do, like they're doing all the major networks, in 30 seconds or less. How would you, but I'm serious, how would you describe the impact generally of police involvement and community engagement on the public health? Real quickly, if you could summarize it in a few words, how important would you say that it is to have police involvement in community engagement, the impact on public health?
Well, you know, one of the things that I saw in this conversation that we had today and in the forum that we had was how important it has become for the police force, particularly here in our area.
Yes.
To think about issues like implicit or unconscious bias, and how they want to address it. And I mean, that is one thing that we are involved in. We actually implemented it across the board at EVMS,
right.
You know, so that our students, starting from the Board of Trustees to staff and students, that is a required training that we should all have. So thinking of that is an important thing.
That's going to have to be the last word. I'm sorry, because we are running out of time. Thank you both so very much for coming on the show today and talking about this this important topic and your own conversation, putting a punctuation mark on everything that has been said thus far. Thank you so very much.
Thank you.
Thank you.
And of course, we want to thank you for joining us today for this edition of Health Watch. Again, if you want to see previous editions of Health Watch, you can see it online at www.norfolk.gov/Health Watch. If you want to drop me a line, you can email me at terrence.afra-anderson@vdh.virginia.gov. You can call me at 757-683-8836, 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Afra-Anderson, and this has been Health Watch.